Today's topic of discussion is extracellular accumulation. Amyloidosis. What is amyloidosis? Extracellular accumulation, which is an amyloidosis, which is most important and common protein deposition. So amyloidosis is a most important common protein deposition inside the tissue and outside the cell or in between the cell. This is called as amyloidosis. What is amyloidosis? That extra protein deposition inside of the tissue or outside of the cell or in between the cell. Amyloid means misfolded protein or all are soluble protein. This one is the misfolded protein. Our view, amyloidosis is due to abnormal production and deposition of protein. So this one is abnormal production and deposition of protein within the tissue of the body. There are several types of amyloidosis, each of which composed of different proteins and associated with certain diseases. So this amyloidosis, which is composed of different protein and associated with different diseases. Microscopical morphology of amyloidosis. We can find amorphous hyaline deposit. In here we find out amorphous hyaline deposits. This light microscope we can find out amorphous hyaline deposits that gives apple green firebrigence. Apple green firebrigence upon polarization after Conco red staining. What is Conco red? It is a type of staining used to stain amyloid. Appear orange red color that helpful to differentiate between certain other accumulate of fibers. So this Conco red stain used to amyloid appearance orange red color that helpful to differentiate certain other accumulation of fibers. Once you have done with staining the specimen under a polarized light, that specimen show change the color apple green firebrigence. So actually it is a orange red color. After polarized light, it shows apple green firebrigence. Next one is electron microscope. Most form of amyloid are 7.5 to 10 nanometer fibril in a beta belated sheet configurations. In electron microscope, 7.5 to 10 nanometer fibril in a beta belated sheet configurations. Some organs, they usually affected by amyloidosis. They are kidney, spleen, liver and heart. So some organs usually affected. What are the organs? Kidney, spleen, liver and heart. So these are the organs that usually affected amyloid deposition. There are two main types: primary amyloidosis and secondary amyloidosis. Primary amyloidosis is light chain deposition. This one is light chain deposition. You can say AL amyloidosis. So light chain deposition. So it have that name AL amyloidosis, whose related protein is made up of copper and lambda light chain. So these ones related protein with the copper and lambda light chain. Primary amyloidosis may be seen in plasma disorder like multiple myeloma or B-cell lymphoma, etc. Primary amyloidosis may be seen in plasma cell disorders like multiple myeloma and B-cell lymphoma. In both cases, multiple myeloma and B-cell lymphoma, a lot of plasma cells they are produced, and those plasma are proliferate. They gives or they synthesis lot of Ig immunoglobulin like immunoglobulin G. So this plasma these multiple myeloma and B-cell lymphoma, they producing lot of plasma. Then this plasma are proliferate and gives or synthesis lot of immunoglobulin like IgG. This light chain of IgG will be more in number, so lot of IgG. That's why they are deposition of a light chain of molecular breed. So it is primary amyloidosis where we can find light chain and AL amyloid proteins, but most cases occur independent of other diseases. Some diabetes may be because of other diseases. Now secondary amyloidosis, second one name is called as reactive systemic amyloidosis, reactive systemic amyloidosis or secondary amyloidosis. Secondary amyloidosis, it have another name reactive systemic amyloidosis. This secondary amyloidosis has amyloid associated protein, that is AA protein, whose precursor is serum amyloid A, that is SAA. So secondary amyloidosis, it have amyloid associated protein, that is AA. That precursor serum amyloid A, so SAA. So what these protein are produced and which are the mainly responsible for production of this amyloid? So during inflammation or chronic inflammatory process, you know, different sort of cytokines they are produced. Then those cytokines act on liver, and the liver through going to synthesis of lot of amyloid protein. So here secondary amyloidosis during inflammation or chronic inflammatory process, lot of cytokines produced. Then these cytokines act on liver, and the liver going to synthesis lot of amyloid proteins. So those amyloid protein start to accumulate in the blood, and from that they reach to that organ, start to accumulate. So here's during inflammatory processes lot of cytokine production, so that cytokines will accumulate into that liver, then it will synthesis lot of amyloid. That amyloid protein start to accumulate blood and reach to other organs. So in case of chronic inflammatory process, you can find some amyloid associated protein from that liver. They start to accumulate different organ. So it has amyloid associated protein. The precursor is the serum amyloid A. An acute phase, there is also called as acute phase reactor producing by the liver, which is elevated or in especially ongoing chronic inflammation or neoplasia. So here serum amyloid A, an acute phase, there is also called as acute phase reactor produced by the liver, which is elevated or in especially ongoing chronic inflammation or neoplasia. In case of cancer or in case of chronic inflammation, there is a continuous production of that cytokine that stimulate the liver for the production of such amyloids. Systemic availability can be seen with a wide variety of chronic diseases. Systemic availability can be seen with wide variety of chronic diseases including rheumatoid arthritis, systemic lupus erythematosus, then tuberculosis, then bronchiectasis, bronchiectasis, then osteomyelitis, then inflammatory bowel disease and cancer. All these diseases are responsible for this position of amyloid associated protein in different organ. So it can seen in wide variety of chronic diseases. That secondary amyloidosis can seen in chronic diseases including rheumatoid fever, systemic lupus erythematosus, then tuberculosis, then bronchiectasis, then osteomyelitis, inflammatory bowel disease and cancer. Next one is familial Mediterranean fever. Familial Mediterranean fever has this AA, that means amyloid associated protein. This amyloid with fabulary amyloid with fabulary protein composed of serum amyloid A. That this one is amyloid associated type with fabulary protein composed of serum amyloid A. This one is autosomal recessive disease characterized by recurrent inflammation, fever and neutrophil dysfunction. That familial Mediterranean fever, this one is autosomal recessive disease characterized by recurrent inflammation, fever and neutrophil dysfunction. Next one, hemodialysis associated amyloidosis. Hemodialysis associated amyloidosis. When the patient undergo hemodialysis multiple times, then there is a deposition of protein. So when patient undergo hemodialysis multiple times, then there is a deposition of protein A beta 2M, A beta 2M type amyloid with precursor protein beta 2 microglobulin. Beta 2 microglobulin. This one, what is the condition? When patient undergo hemodialysis for many time, that time only that protein accumulation A beta 2 type of proteins, precursor protein beta 2 microglobulin. This form of amyloidosis may causes carpal tunnel syndrome and joint disease. So this hemodialysis associated amyloidosis causes carpal tunnel syndrome and joint disease. So next one is senile cerebral amyloidosis. This one is seen in Alzheimer's disease. Senile cerebral amyloidosis, this condition seen in Alzheimer's disease. It has A beta amyloid with fabulary protein composed of beta amyloid precursor protein BAPP. So it has A beta type amyloid with fabulary protein composed of beta amyloid precursor protein. It is found in Alzheimer's plaque and in cerebral vessels. This one found in Alzheimer plaques and cerebral vessels. Another protein TTR, transporter of tyrosine and retinol. Transporter of tyrosine and retinol protein, deposition of senile cardiac and systemic amyloidosis with fabulary protein composed of transthyretin. So this TTR, deposition of senile cardiac and systemic amyloidosis with fabulary protein composed of transthyretin. This type of amyloidosis is seen in men older than 70 years. This one mainly found in men after 70 and may causes heart failure as a result of restrictive or infiltrative cardiomyopathy. It causes restrictive or infiltrative cardiomyopathy. Last one is endocrine type of amyloidosis. This endocrine type amyloidosis seen in medullary carcinoma of thyroid, adult onset diabetes and pancreatic islet cell tumor. So last one is endocrine type amyloidosis seen in medullary carcinoma of thyroid, adult onset diabetes and pancreatic islet cell tumors.